Hey everybody, welcome to tonight's presentation. Welcome, welcome. I'm just getting my slides up here. Oh, it looks like my phone is recording everything that I'm saying. How are you guys? Wanted to let you know there is a chat feature for anybody who is on here. So you can post in the chat box. I'm happy to answer questions. We're going to be doing a live Q&A at the end. So if I see a question in the chat box and I don't get to it right away, know that I'm going to be coming back to those at the end. For those of you who are popping on, find that chat box so that one, I can find it. So if you wouldn't mind posting in the chat box where you are from, what city or what state, what province, that would be particularly helpful so I can see. Q&A, there we go. And everybody can see my screen. Is that correct? You can see the presentation. Texas, Orangeville, Maryland, amazing. Northern Virginia, Quebec, fantastic. And it looks like you cannot see me now. Give me a second here as I get this up and running. Okay, while I'm fixing the camera, tonight's presentation is all about blood work. We're going to be going through some basic features of blood work, what to look for, what they might mean for you. We're going to talk about normal versus optimal levels because we all know that, I'm sure many of you on here have been told that your labs are normal, but you just don't feel like you're normal. So most times what happens is there's not enough testing that was run, or we're just not interpreting them within the optimal range. For those of you who don't know me, my name is Dr. Kallonen. I'm a naturopathic doctor and functional medicine practitioner, and my goal is to get to the root cause of why individuals feel the way that they do, okay? The presentation recording will be sent out, yes, but if you wanted to take notes, absolutely grab a pen, grab paper, you can take the notes, but in 24 hours you will be getting the recording, and then you can go through it again if you need to brush up. So you're in the right place if you're interested in learning about your health, learning about what blood work can tell us. You're in the right place if you've been told your labs are normal, but you don't feel normal. I've personally experienced that before, and that's really what led me into a career in functional medicine. You want to optimize your health and believe in preventative medicine. So we have to remember that traditional conventional medicine is not looking for prevention. It's looking for, do you have X diagnosis that we can treat with Y? And do you feel like your doctor has perhaps not run enough labs? We're going to be talking about what comprehensive testing looks like, as well as I'm going to be sharing some resources with you if you want to order your own blood work or some ways that you can go about accessing the appropriate testing. So again, I'm Dr. Kallonen, practicing functional naturopathic medicine. I'm also the creator of the Metabolic Reset program and author of the best-selling book Wild and Free. That's available on Amazon. Most importantly to me, I'm a mom of two. So I have two kids, a 7- and 9-year-old girl and boy, Aiden and Evelyn. And I believe that when individuals are provided with the right info in the right context, they're able to make their own best health choices. So my goal is to provide you with all of the available options. So what are the benefits and risks of option A versus option B? And then you get to make the choice in terms of which one you feel is best for you. Natural always doesn't mean better, and pharmaceuticals are not all bad. So we do discuss in my practice a lot with patients, here are all the pharmaceutical options available for you, here's the natural options, and sometimes we do a combination of both. And it's most important if you are doing something, whether it's a pharmaceutical or a supplement, that you're repeating the testing to make sure that what you're doing is working, because you can't manage what you don't measure. What we'll cover today, we're going to be going through the basic blood work. We're going to be talking about clues to what each marker means. I'm also going to go through some functional medicine testing. So this is testing that looks more so for functional ranges. Now what that means is there's normal ranges where majority of the population falls in. That's how we actually create normal ranges, and we just say, what is the vast majority of people falling into, and there's our normal range. But that doesn't necessarily mean the functional range. What is the range that is optimal for people to function at their best? We're going to talk again about how to run your own labs and how you can optimize your labs, as well as at the end, I'll be discussing some ways that we can work together as well. Of course, the legal stuff, the fun jargon, this is not medical advice, education only. It's not intended to diagnose or treat. I am a doctor, but perhaps I'm not your doctor. So take this all for educational purposes only. Normal versus optimal. So often when I see patients, I'll ask them, when was the last time you had your blood work done? And they'll say 5 years ago, it was all normal. Keep in mind that normal 5 years ago does not mean normal now. Normal doesn't mean enough was run. If you truly don't feel normal, that's all I need to run additional testing, because it's most likely that you're not in the optimal range, or we just haven't uncovered what the root of the issue is. Values within the normal range can still be associated with increased risk of certain diseases and mortality. Now, what does that mean? An example of this is with the marker CRP, which is a marker for inflammation. We're going to be going into this in more detail. We know that the normal range, based off of the blood work, it says normal is less than 5. But then it says in small print, anything greater than 2 increases your risk of cardiovascular disease, which is the leading cause of death. So maybe you're normal at a 5, but if you're at a significant increased risk of the leading cause of death in North America, then you need to know that. And there are things that we can do to mitigate that risk. Individuals' variations also exist. So what is optimal for Susan might not be optimal for Katie. And we really have to look at your symptoms and how you're feeling and take it into context. So often we're trying to put patients in boxes, and if you don't meet this checklist or this criteria, then you're sent home with nothing, which can be really frustrating. I also don't feel that you need to wait until your labs are quote unquote bad enough in order to get a diagnosis or get treatment. So there are many things that we can do to prevent having to go down the line of being diagnosed with X, Y, and Z, which we'll talk about. Interestingly enough, the way that we create these normal ranges is to ensure that 90% of the healthy population falls into it. Now, this is a particular problem because the quote unquote healthy population, what defines health? There is research that suggests only 12% of the American population is metabolically healthy, but yet they're falling into these really broad reference ranges. So normal range does not mean optimal, does not mean the best range for you. Okay. Is that all making sense so far before we go dive into the CBC, as it's called? Put a little yes in the comments if that makes sense. Good, good. So we recognize that just because it's normal doesn't mean it's optimal, and there's variations between person to person. Yes, yes, yes. Okay, fantastic. Now, the way I've divided this presentation is in the order that the labs are typically presented. If you are going to Quest, though, they like to mix all these markers into one. So if I'm going too fast, let me know. But typically when I'm running blood work, this is the order it's presented in, and most labs do this. So the hematology report, this is looking all at your blood cells. So your white blood cells and your red blood cells. WBC is a white blood cell, RBC, red blood cell. So in this example, the white blood cells are within the normal range. The differential is the different types of white blood cells that make up the total. So you have neutrophils and lymphocytes and monocytes and eosinophils. Those are all the different types of white blood cells that contribute to your total. Neutrophils and lymphocytes make up the majority. These are ones that protect you from viruses and bacteria. They will become higher in acute states of infections. Chronic infections, if the infection's been there a long period of time, they can go lower. Ebbs and flows in the white blood cell is completely normal, but if we are seeing low levels, it definitely is something that you want to consider monitoring. Eosinophils and basophils, these ones really should be low. Eosinophils only come up in states of allergies or in significant parasitic infections. So by looking at the types of white blood cells in those reference ranges, that can provide us with clues to what else is going on in the body. Red blood cells are particularly important because they carry oxygen and nutrients around the body. When red blood cells go up, you can think of it as the tissues are not getting enough oxygen. So your body's trying to make more red blood cells to compensate for that. High red blood cells like this, I always question about, are you breathing properly? Why is your body trying to make more red blood cells to oxygenate the body? So is there sleep apnea? Is there breathing conditions like asthma or COPD? Dehydration can cause this as well. In addition, higher levels of testosterone can raise red blood cells as well. So if you are a female on bioidentical hormone replacement, we'll be always running a CBC, or a male will be running a CBC to make sure that's not coming up. When your red blood cells are low, we think of destruction, or why are they being damaged, or why are they being removed? We can also think of nutrient deficiencies. Maybe you don't have the building blocks to build those red blood cells. So that gives you a general idea about white and red blood cells. MCV is the next one I pay attention to. This tells us a little bit about the size of the red blood cells. You want to be right in the middle, around 90. This comes down to things like B12 deficiencies, iron deficiencies, if we're starting to see changes. So if they're larger and the MCV is going up, we might be seeing issues with B12. Now, we always want to look at, if you do have low B12, always ask why. That's where functional medicine and naturopathic medicine really shines, asking why. Why is that B12 low? Are you not absorbing it? How's your stomach acid? You need stomach acid to absorb certain vitamins and minerals. How's your nutrition, right? If you don't have proper adequate intake of nutrients to build your red blood cells, then we have to look at that. As a side note, this is the hardest part of the presentation tonight. Everything else gets easier, so just hang in there with the CBC. Platelets tell us, can your body form a scab if you were to get injured? And they also tell us, if they're high, are you at increased risk for blood clots, cardiovascular things like heart attack and stroke? Platelets can be raised in states of inflammation and insulin resistant issues, and we're going to dive into a little bit more detail about those coming up. And the birth control pill can raise levels of platelets as well. So we see increased risk of blood clots associated with the use of that. We talked about the white blood cells. Definitely want to have a look at autoimmune conditions, chronic stress, deficiencies, perhaps issues with the bone marrow if you're not producing enough of those white blood cells. The most common things I see here in my practice is I see the red blood cells increasing because individuals perhaps are having sleep apnea. I also see low levels of hemoglobin, low levels of MCV, suggesting an iron deficiency. That's most common that I see. Anemias. The definition of being anemic comes down to, is your hemoglobin low? So if we look back on this slide, the hemoglobin here was within range. So technically this individual would not meet the diagnosis of being anemic. But I want to know, how far away is this individual to being anemic? Where is the actual levels of iron? Where is the actual levels of B12? Because if you're really, really close to being anemic, we still want to help you out, especially if you're feeling symptoms like being tired. So we can look at levels of B12 and we can look at ferritin. This tells us stored form of iron, or I think of this as how much money do you have left in the bank, or how much iron do you have left before you go anemic. So it's really important to not just look at the hemoglobin, but also look at the levels of B12 and ferritin. I like to see B12 greater than 500, and I like to see ferritin greater than 50. So look at how broad that reference range is for the ferritin, 5 to 272. I would say that ferritin in Ontario, if you're in Ontario, it's a province in Canada, this is the lowest I've ever seen. So the reference ranges for labs are different province to province and state to state. Ontario, for whatever reason, has lowered the threshold for ferritin to 5. Nobody feels good with a ferritin of 5. It really should be more so around 50. If hair loss is a symptom, greater than 80. One thing to keep in mind with ferritin is ferritin can be artificially increased. So it looks like, oh, your iron's pretty good. It could be artificially increased in states of inflammation. So that's why it's important when you're looking at feeling tired and you're wondering if you're iron deficient, to also run the blood markers of inflammation to see if that's a true reflection of where your iron status is. So looking at CRP, which we'll talk about in a previous or the next one coming up. So ferritin, really important for energy. It's important for your thyroid to work. Iron's important for producing dopamine, your motivation hormone. So key to have a look there. Why is low iron a big deal? So I jumped ahead. I got a little excited about iron. So many people have low iron and they brush it off as, oh, it's just iron. It's just a vitamin. Or individuals are told that they're low in iron, but they're not given instructions in terms of the dosaging, what form of iron to take, anything like that. So it is important that you look at, is your ferritin in the optimal range? It's required to make thyroid hormone. It converts the amino acid tyrosine to dopamine. Dopamine is the motivation hormone in your brain. So if you're not motivated to do things, that can be particularly challenging. Iron also allows your body to carry oxygen around it. So if you are not being able to carry oxygen and oxygenate your cells, you can have fatigue, brain fog, slowed metabolism, low motivation. If you're not getting enough oxygen to your muscles, you try to exercise and you have a ton of lactic acid buildup. So that becomes particularly challenging in terms of, are you even exercising to the best of your ability? Recovery can take a lot longer. And we know that both low and high levels of iron create issues with your metabolism because of the influence it has on insulin resistance. We're going to be diving into insulin resistance a lot. Just know iron is a big deal when it comes to weight management and energy. So don't brush that off as nothing. Next is the blood sugar evaluation. So a fasting glucose or fasting sugar, that tells us what your blood sugar is when you haven't ate at the exact moment of time where the blood work was done. So for this individual, they had a fasting glucose of 5.3. Not a problem. 5.3 is not the end of the world. Hemoglobin A1C tells us on average over the last 3 months or 120 days, how has the individual been managing their blood sugar? 5.7, technically this patient would be told, yep, it's normal, you don't have diabetes. Because diabetes is, pre-diabetes is greater than 6, diabetes is greater than 6.5. But this individual is falling in the at-risk category. So it's really important to have a look at your blood work. Insulin resistance and having changes with your blood sugar, when you are in this at-risk category, it's really important that we reverse it. This is a key opportunity where we can look at diet and lifestyle, we can look at meal timing, we can look at supplementation, there's pharmaceuticals that we can use here. We need to pick blood sugar issues up right away. I also like to measure this each and every year because if you typically sit at a 5.7, your weight's great, your energy's good, and the 5.7 doesn't change, fantastic. You could stay in this at-risk category forever as long as you're feeling good and it's not changing. But if you all of a sudden went from a 5.4 and then the next year you're up to a 5.7, then that has been a significant change for you and we need to understand why that is. So I like to see hemoglobin A1C less than 5.5. Hemoglobin A1C and how you're managing your blood sugar does not tell us how hard has your body had to work to keep your blood sugar under control. We want your body to very easily keep your blood sugar under control. When your body's starting to work extra hard just to keep your sugar stable, we see insulin resistance. So this is where it comes down to, like the hemoglobin and the ferritin, knowing how far away are you from being anemic, we can do the same. Where are your insulin levels and how far away are you from jumping up to the prediabetes category? According to a 2015 study, nearly 50% of the adults in the US have diabetes or prediabetes. Not all of this is diagnosed, so it is quite important that you have a look at, are you measuring a metabolic panel every single year? And you don't need to have weight gain to have diabetes. You don't need to have weight gain to have insulin resistance. We're going to dive into what insulin resistance is. This is something that precedes diabetes. There's really great pictures coming up, but here are the signs and symptoms. Fatigue, anxiety, ups and downs in your mood can be attributed to changes in your blood sugar, increased thirst, urination, hunger, infections that you can't seem to get rid of, like yeast infections or UTIs. Insulin resistance often underlines individuals with PCOS. Regardless if you are overweight or not, you can still have insulin resistance with PCOS. Insulin resistance can contribute to irregular periods. It can contribute to loss of hair on your head, skin tags, HS, a skin condition. Darkening of your skin can be a sign of insulin resistance, especially around your neck, in your groin area, behind your knees. Painful heavy periods, blood pressure, high cholesterol, impaired immune system. Resistant weight loss is a big one, as well as a waistline over 40 inches in men and 35 inches in women. So that's a really easy measurement that you can do at home. Just grab a tape measure and see where your waistline is, and then go get some blood work done. How does insulin resistance develop? Huge component of insulin resistance is genetic. So if you have a family history of diabetes, Alzheimer's, high cholesterol, heart attack, I would highly recommend running markers for insulin resistance each year to make sure you're not in that at-risk category. Of course, processed food, sugars, alcohol can increase your risk. Stress contributes to insulin resistance because stress will raise your blood sugar. Blood sugar causes your insulin to go up. Insulin resistance over time can develop. Nutrient deficiencies can make your blood sugar management worse. They can make insulin resistance worse. So if you're vitamin D deficient or you have low iron, that's going to make it harder for your body to respond in terms of the relationship between glucose and insulin. And we're going to dive into a little bit more detail with that. Poor gut health. So there is certain types of bacteria that are protective for insulin resistance, protective against weight gain, protective against inflammation. So it's important to have a good diversity and an abundance of the good bacteria. Poor sleep. Poor sleep can contribute to insulin resistance. Just losing out on 1 hour of sleep a night, maybe you're putting on, an extra episode on Netflix, losing out on 1 hour of sleep just after 1 week has been shown to increase inflammatory markers, TNF-alpha, IL-6, you don't need to worry about what those are, but it increases inflammation and it shows a rise in insulin resistance. We're going to dive into one of my favorite diagrams, and this is going to help explain why just measuring blood sugar is not enough. So that comes back to the fasting glucose and the hemoglobin A1C. It's not enough just to measure that. We have to look at how hard has your body had to work to keep your blood sugar under control. So when you eat carbohydrates, and it doesn't matter if it's cake and cookies or apples and sweet potatoes, you eat those carbohydrates and they're digested into sugar. These red squares resemble the sugar in the blood vessel, in your bloodstream, after you ate carbohydrates. After you have sugar in your bloodstream, it tells your pancreas to produce insulin, and insulin is depicted by these keys. The keys help to open the cell to get the sugar into your cell. We want sugar to get into the cell so we can generate ATP or energy, so that your brain can feel good, so that your muscles can feel good, all of that good stuff. Now, individuals who have insulin resistance, there becomes an issue with this lock and key. So all the pancreas knows to do is just produce more keys. It says, oh, the blood sugar is still high. We need more insulin. We need more insulin. We need more insulin. Now, the problem is insulin is a fat storage hormone. So if the sugars can't get into the cells, all the sugar is going to be diverted into storage. Now, the problem with that is we see weight gain, of course. We see high levels of cholesterol. That can cause some levels of inflammation too. But your cells are like, hey, we didn't get any sugar. So then that's where we see starvation. Like cellularly, individuals are really lacking the nutrients. They have lots of stored calories in the form of body weight, but they're not able to utilize them efficiently. So we'll chat about some strategies to help mitigate this, but we really need to measure a fasting insulin in addition to your blood sugar to know whether or not you're at risk of insulin resistance and how it's changing over time. Insulin resistance causes issues with the irregular cycles, especially in patients with PCOS. That can lead to issues with getting pregnant. Insulin resistance, when it's high, we see weight gain. And again, if you always have the storage switch on, that's going to be particularly challenging, even if you're eating a healthy whole foods nutrition plan. Even if you're in a caloric deficit, if your insulin's high, it is much more challenging. And while calories and nutrition really matter, absolutely they do, if we can make it so your deficit doesn't need to be as great, and we can make it so that your appetite is not crazy and you're feeling really good and your energy's under control, and we can actually start to see weight loss faster, individuals stay much more motivated. Does that make sense about insulin resistance? Do you understand? Just put a yes in the comments why it's not enough just to measure hemoglobin A1C. Yes, okay, I hope those diagrams made sense. This is another test that you can utilize. This is a 2-hour oral glucose challenge test. If you have prediabetes, maybe you did this test. If you've been pregnant, maybe you did this test. Now, for this test, you go in, they take your blood work when you're fasted, and then you drink that delicious 75 grams of glucose drink, and then they measure your sugars after. Typically with this test, the only thing that's done is the sugar. So we look at, okay, your sugar's low at baseline, you drink that delicious drink, your sugar goes up, and then it should come down. So the dotted line is the normal in terms of the glucose response. You can also measure insulin at the same time, and that's what I like to do. I want to see at your baseline 0, is your sugars low, right? You haven't ate anything, your sugar should be low normal. We don't want them too low. But your insulin should also be low at that point in time. If you start with a baseline insulin that's really high, you're not going to get the added benefits in terms of weight loss overnight when you're fasted. So we really do want to get that fasting insulin level down. After you drink the sugar drink, your sugar should come up and your insulin should come up in response. But what we should see is your insulin goes up, it peaks, and then it starts to come back down at that 2-hour mark. For many of my patients, I see the insulin levels still going up at that 2-hour mark. So if your insulin's high at 2 hours, again, it's a fat storage hormone, and then you have another snack, your insulin level stays high and goes higher. So this chronic perpetual insulin levels that are high make it really hard to lose weight. That's why intermittent fasting and a lower carbohydrate approach is particularly helpful for patients with insulin resistance. Now, it's not the only option, and if we can do things to support getting insulin down faster, you're going to feel better faster and you're going to see results faster. So the red here would not be what we wanted. That insulin level has gone way up and continues to go up. Here are the optimal range. So if we look at the reference range for fasting insulin, many of the labs go up to 200 for a fasting insulin. I really want to see a fasting insulin less than 40. In the US, the ranges are a little bit different. So fasting insulin in the US, I like to see less than 5. Now, again, this comes down to individual variations. If you have a fasting insulin, I want it less than 40, like 20 to 40. If yours is 60, but you feel really good, you're not having any symptoms, and your weight's well maintained and you're energized, amazing. That's your optimal. But we need to interpret and really write down and say, okay, here's where you feel good. We need to establish a level of this is where you personally feel your best. And then we can measure year by year to see if you're deviating away from that. Now, the downfall to this test, of course, as much as I love it, patients don't love having to get poked all the time, and they don't like sitting at the lab for 2 hours, and they don't like the drink. So that's why, as much as this is really, really valuable, sometimes I'll just measure the fasting ones in the morning and infer from that. So here's a case study that I did on a patient prior to joining the Reset program. We measured the hemoglobin A1C. They were at a 5.3. So remember, this puts them at 0 risk. They're not even in the risk category of prediabetes, but they had a really hard time losing weight. Their doctor had said, well, your blood sugar is normal. It's normal, it's normal, it's normal. You don't have diabetes. But look at the fasting insulin levels. Again, I want this fasting insulin 20 to 40, and they were at 203. So again, if that insulin's high, the fat storage switch is high, they're never going to get the opposing hormone glucagon coming up, which helps with fat burning. In addition, if her fasting is at 203, she's going to have to fast long time in order to get the insulin levels down. And we want to make nutrition and lifestyle sustainable and easy. So this individual will have a lot of food cravings. They'll have trouble fasting because they can't break down their fat for fuel. That becomes an issue, especially when fasting. So we want to treat this insulin piece, and we need to test for it. This individual as well had higher levels of cholesterol, higher levels of triglycerides than I would like, and their HDL, or their good cholesterol, is not as great. Higher levels of cholesterol absolutely have to do with insulin resistance. This is the problem. The insulin is so high. She doesn't need a statin medication. She doesn't need a cholesterol medication. Her problem's not the cholesterol. Her problem is the insulin that is driving that up. So looking more at the root cause approach. This patient as well also had higher levels of inflammation. So CRP is a marker of inflammation. And here, look at the risk groups. Low risk, less than 1. Moderate risk, 1 to 3. High risk, greater than 3. This has now been changed in many of the provinces in Canada to less than 5 is fine. So less than 5 is fine, even though you're at increased risk according to the American Heart Association of cardiovascular disease, the leading cause of death. So if you didn't have enough testing done, or you just went with the quote unquote normal ranges, this patient will be told that they're fine. And heart disease ran in the family as well. So this is something we absolutely want to look at. There is high levels of inflammation, in my opinion, in response to this high levels of insulin. So we just treated the insulin to get this all down. We also measured something called sex hormone binding globulin. This is often low when individuals have insulin resistance. So this is not the top priority to run, but if I'm sending a patient to the lab, I kind of like to run as much as I can. This patient, we also did a thyroid panel on. Her thyroid antibodies were low, so the immune system was not attacking the thyroid gland. And overall, her levels of T3, the active thyroid hormone, were pretty good. If you have insulin resistance, that can negatively impact the thyroid. So it's important to look at both, especially in patients with PCOS. We see a common concurrent picture where patients with PCOS have issues with their thyroid as well. And just because your thyroid panel was normal last year does not mean it's normal this year, especially if you have symptoms. So this patient did the MRP, patient that we just looked at her labs, she lost 20 pounds. And then what we did is we repeated the testing. So the first test, I just did a fasting insulin, and then I was able to convince her to do the drink, where we measured her insulin at the half-hour mark, 1-hour mark, and the 2-hour mark. So yes, 20 pounds is absolutely amazing. She's done fantastic in terms of her insulin. Previously, it was over 200. Now her fasting insulin's down to 123. But we can't stop here. So we know optimal, or my opinion, optimal is 20 to 40. She still has a ways to go. And look at her insulin level at the 2-hour mark. Right? That's where it should start to come back down to 250. And she's at 1,338. So yes, 75 grams of sugar is a really big dose of sugar on the body. So this wouldn't be typical for every day when you're not having, Dairy Queen blizzards every meal, but that is still particularly high. This individual is not a good candidate to put in a ton of carbohydrates. She is a great candidate for doing resistance training because that can help. But for a little bit more time, we want to focus on carbohydrates coming from fruits and vegetables. We don't want to add in a lot of processed carbohydrates, breads, pastas, things like that. It's not to say that higher carbohydrates are bad, right? Carbohydrates are not bad, but this patient in particular cannot tolerate the carbohydrates. The response is not great. So that's what we did for her in the maintenance phase. We just focused on more fats. And then once the insulin comes into control, then absolutely, let's add in more carbohydrates. Vitamin D. So this is one we're going to dive into a little bit more coming up. But for her, her vitamin D was particularly low. Vitamin D has been associated with insulin resistance. So nutrient deficiencies can make insulin resistance worse. Vitamin D can cause muscle pain when it's low. Deficiency can cause mood changes, so seasonal affective disorder, muscle pain, issues with your thyroid. So much comes down to vitamin D. It's really important that we look at making sure that's optimal. Optimal levels are anywhere from 100 to 150 in Canada. And there are slides coming up where I break down, here's the Canadian reference range and here's the US reference range, because I know I have individuals from both countries. Nutrient deficiencies and insulin resistance. This is where diet and absorption comes into play. So here are all the micronutrients that have studies on them. Here are the human studies, here are the animal studies, to suggest that they actually make insulin resistance worse. So we need to get away from blaming individuals for having insulin resistance and diabetes. One of the key things I really wanted to hone in on here is there is a huge component to insulin resistance and genetics. It's not because an individual ate processed foods over and over and over again. That's not the case. Genetics, sleep, stress can do it. Gut health can do it. Nutrient deficiencies can do it. So here we're having a look at iron. That was one that we talked about. Impaired glucose metabolism. It can cause issues with insulin resistance. Same with deficiencies in magnesium. Magnesium is one of the most common nutrient deficiencies in North America. I would say every single one of my patients gets some form of magnesium, whether it's a magnesium supplementation or the Relax and Focus, which is fantastic for calming anxiety. It has inositol in it for blood sugar, but also has magnesium in it. So I've tried to put magnesium in multiple products because of how important it is for individuals. Selenium and zinc are other ones that are really important for keeping your blood sugar under control. Selenium and zinc are also really important for the thyroid gland, which we'll see. Individuals who are on birth control is known to deplete magnesium, B vitamins, and zinc. So we see that there is some association between hormone-based birth control use and increased risk of insulin resistance. So for a PCOS patient who's having irregular cycles or really heavy periods, going on birth control is not going to fix the problem. It's not going to fix the insulin resistance. If anything, it's going to make it worse. So this is where figuring out, are you taking enough of these nutrients in your diet becomes particularly important. General considerations for insulin resistance. I know individuals can get frustrated when I don't give a clear cut, here's exactly what you need to do. And the reason is every single individual is unique. Every single individual has different needs. So if your insulin resistance is being made worse because you're not sleeping, we need to focus on sleep. If your insulin resistance is being made worse because of nutrient deficiencies like low vitamin D and magnesium, we need to have a look at that. Lower carbohydrate approach can help, but it's not the only solution. And we don't want to make your nutrition so restrictive that it's not sustainable. That does not help anybody. So if we can look at, okay, what are the other factors unrelated to diet that is making it more challenging to manage your insulin, let's fix that. Berberine is one of my favorite to use. It's a herbal-based product. It's been shown to be as effective as the pharmaceutical for insulin resistance, metformin. Metformin's great as well, but the problem with metformin is some individuals can't tolerate it. It has some GI upset or stomach upset that it can cause for some patients. Metformin, if you're on it, fantastic. If you're tolerating it, but keep in mind for anybody who's here on metformin, it can deplete folate and B12, so you might want to get those levels checked or at least consider supplementing with something like a B complex. Intermittent fasting can be helpful to lower insulin, but again, let's go back to that previous example. I had that patient fasting for, I think it was at least 12 hours, and her insulin was still 203. So for an individual who intermittent fasting is not able to bring the insulin down, it can be particularly disheartening when they're not seeing results, or particularly disheartening when they're not feeling as well, or particularly disheartening to just say, well, you need to fast longer. So if we can do things to help improve it so that you're actually getting the benefits from a lower carbohydrate approach and an intermittent fasting approach, then great. And we also need an exit strategy. So if you are doing a lower carbohydrate approach, how will you know at what point in time can you cycle carbohydrates back in? Another thing to consider is avoiding snacking. So the example where the insulin was still high at the 2-hour mark, if you went and ate another meal, then the insulin's going to go up further. So you do have to give time between each of your meals to allow insulin to come down. Trying to be consistent with your meal timing is particularly important. 2 to 3 meals a day. Take the snacks out. Don't eat before bed. Don't eat 4 hours before going to bed. Allow your body to wake up in the morning before eating. All of those are really great approaches. Does that make sense? Inositol can be particularly helpful for lowering thyroid antibodies and keeping blood sugar under control. So if you are a PCOS patient, or you know you have insulin resistance issues or prediabetes, there is another full presentation where I talk about each supplement that I consider. It's the PCOS one. We're going to go into a little bit more detail, but that presentation might be helpful as well. Okay. Inflammation here. Again, ideal CRP or inflammation is less than 1, but here is an example of what they've now done with our reference ranges. So what I showed you before with the less than 1 is optimal, 1 to 3 is increased risk, greater than 3 is high risk. This is how they report it now. So anything less than 5 is considered normal. So that's a particular problem because we know it says here in the fine print, cardiovascular disease, increased risk, life-enhancing factor for cardiovascular disease when it's greater than 2. But you probably will be told that your labs are normal, go home. But if you're greater than 2, that's definitely not normal. The other thing we want to consider is, why is the inflammation high? Sometimes we will never know, but it could be because of insulin resistance, blood sugar issue, gut inflammation, chronic stress, autoimmune conditions. You can also have acute short-lived inflammation. So if your inflammation's high, like greater than 10, it could just be that you had a really hard workout, or maybe you have back pain, or maybe you have a flare in your joint pain, or maybe you're just sick, right? Those are all normal times where inflammation should go up, but then we should suspect it to come back down. So if it's particularly high, repeating it to see if it comes back down. Even things like Crohn's and colitis, irritable bowel diseases, we can see higher levels of inflammation. Now, inflammation is more important, in my opinion, than looking at cholesterol in terms of risk of heart attack and stroke. Cholesterol gets a bad rap, but it just happens to be at the wrong location at the wrong time. So what is cardiovascular disease? We see damage to the blood vessels. Inflammation is creating the damage, and the cholesterol is just coming on to try to repair. So cholesterol is there, it's contributing. Yes, it causes problems, but it's not the root of the problem. The inflammation is. So we always have to look at cholesterol in relation to the inflammatory markers as well. Homocysteine is another one. So for anybody who's on here who has a strong family history of cardiovascular disease, heart attack, stroke, you might want to consider testing an extra blood marker called homocysteine. This one shows increased risk of cardiovascular disease. We know that homocysteine can actually be managed and be helped when we supplement patients with B6, folate, and B12. Some people genetically are more prone to having higher levels of homocysteine, and we can actually push it through this cycle with the active B vitamins. So we know cardiovascular disease is a genetic component, so why don't we fix the expression of those genes? Of course, the genes you are born with are the genes that you have, although we can change how those genes are expressed with diet and lifestyle. General considerations for inflammation. I talked about previously how missing out on 1 hour of sleep a night, just in a week's time, increases pro-inflammatory cytokines TNF-alpha and IL-6. Sleep is critically important. If you are not sleeping and you have issues with your blood sugar, issues with weight, issues with inflammation, issues with mental health, sleep is where you need to start. If you are having issues with your immune system or autoimmunity, or you have a concussion or had a concussion, or if you're having brain fog, you need to look at sleep. And some individuals have issues even with snoring and sleep apnea. That needs to be addressed and treated. Always go back to focusing on sleep. Key strategies for sleep: keep your room dark, keep it cold, things like melatonin or the relax and focus with the inositol and the magnesium in it. You have to do something to fix your sleep. You can use things like omega-3s for inflammation. That's fish oil. I love, obviously I'm biased, but I have the pure hypo omega. That's a great source of omega-3. It's very clean, doesn't have any heavy metals in it. And omega-3 supplements are not all created equally. So you want to find a triglyceride form of fish oil, because that's the form of fish oil that you would get when you eat it. You can also eat salmon. Anti-inflammatory diet would be focusing on tons of fruits and vegetables, lean meats. If you can get organic or grass-fed, grass-finished, that's going to be fantastic. Green tea, berries, all anti-inflammatory. We also have to remember, though, that not all foods are less inflammatory for each individual. There are some foods that, or even healthy foods that can create inflammation for each individual. So one of the things we do in the Reset program is we remove the top inflammatory foods for the 6 weeks of losing. Then we strategically add them back in maintenance. If you have a reaction to one of those foods, we say, okay, that food's inflammatory for you. Let's keep it out for now. But we also monitor nutrition over the losing phase, because we want to identify, is there any other healthy foods that we haven't thought of that are particularly causing inflammation for that individual. I've also included N-acetylcysteine and liposomal glutathione in here for inflammation. There are some individuals genetically that are more prone to inflammation because they're not able to detoxify properly. If that's the case for you, then N-acetylcysteine and glutathione might be helpful. N-acetylcysteine, 400 milligrams, is also anti-anxiety, so that's a big one that I particularly like. Cholesterol. So we talked about how homocysteine and the inflammatory piece, measuring inflammation, is most important when we're looking at risk of cardiovascular disease, but cholesterol panels can be helpful as well. Keep in mind, if you are if you are doing a low carbohydrate approach, your LDL, or quote unquote bad cholesterol, can actually increase 6 months, up to 6 months to even a year. So maybe you've lost 20 to 30 pounds, you're all excited, you go get your blood work done, and your doctor says, oh my gosh, your LDL cholesterol has gone even higher. Now you're at a higher risk category. No, we know that is a compensatory mechanism for individuals who are doing a lower carbohydrate approach. Yes, monitor, but just keep that in mind. It's not necessarily the problem. As long as your inflammation is low and your HDL, your good cholesterol, is high. So definitely, if your HDL is not greater, ideally at the very minimum 1.3, but optimal greater than 1.8, we can see that in individuals with fatty liver, even issues with your thyroid. We can see cholesterol go up. Anybody who's struggling with resistant weight loss and their cholesterol is going up, especially females, but males too, I'm always running a full thyroid panel. Having hypothyroid, low thyroid, can cause your cholesterol to go up. So it's always about looking at trends and looking for cues. Considerations for cholesterol. Statin medications have high risks, and we want to look at the benefits and risks of each individual instead of putting every single person on a statin medication. If you can manage insulin resistance, diet and lifestyle, and we can fix insulin resistance without the use of medications, or we can fix cholesterol without the use of medications, that's fantastic. Statin medications are known to deplete a very important nutrient called CoQ10. If you're on a statin medication, all of my patients, if they're on that, they're on a CoQ10 simultaneously. If you are on a statin medication, we see increased risk of diabetes. We see low energy because of the depletion in CoQ10, and we can see muscle pain, which can be pretty debilitating for patients. Other considerations for cholesterol, of course, is diet and lifestyle, managing your blood sugar. So that's where the berberine comes down to, really helpful for the insulin resistance. A specific form of vitamin E called delta tocotrienol, or just a natto-E, has had some really great research on it. Omega-3s, an anti-inflammatory diet, of course. Remove processed foods, remove sugar, remove alcohol. And I have in terms here, inflammatory fats. When you heat fats to high temperatures, what we see is they form AGEs, advanced glycolic end products. Heating fats is not good. Heating fats makes them pro-inflammatory. Doesn't matter if it's avocado, olive, coconut oil, you don't want to heat your fats at high temperature. You can add them after. I would try to avoid the cold pressed oils as much as possible and get your healthy fats from salmon, nuts and seeds, avocado, olives, the actual foods as much as possible. Now you might be wondering, well, what am I going to do to cook? Instead of using olive oil for stir fries and things like that, I recommend cooking with a broth. So a vegetable broth, a chicken broth, beef broth, anything like that, or water and spices. So that's something that you can try out. Now, of course, it doesn't have to be all or nothing. If you are like, well, I'm not going to be able to do that with eggs, that's the biggest example that always comes up for individuals, fine. But if there is some opportunities for you to reduce the heating of the oils, that would be fantastic. Another consideration for cholesterol is propylamanin. So propylamanin is a highly specific form of glucomannan. Glucomannan is relatively inexpensive. It has zero research on it to be effective at all against cholesterol. You want the propylamanin. That's within the Fibrelline, or there's other companies that also have propylamanin as well. Liver enzymes. So I had a question at the last presentation about GGT. GGT is interesting. So when it's high, we think of issues with the liver, with the gallbladder, but when it's low, typically the response patients will get is, oh, we don't know why, don't worry about it. But we do know when it's low, it might signify additional need for magnesium and B6. It can also be low in cases of hypothyroidism or if you're on the pill. So looking at liver enzymes can be particularly helpful for clues again. Now, why should you be concerned with liver inflammation? The liver is great at regenerating. The liver is fantastic at repairing, but we also know the liver is really important for thyroid health. About 20% of your body's thyroid hormone is actually converted just with the thyroid gland. So your thyroid produces an inactive thyroid hormone, T4, and has to convert it to T3. 20% of that happens in your thyroid, but the 80% comes from the liver and the kidneys, and the gut bacteria play a role too. So if you want to have good levels of active thyroid hormone, you need to address liver health, especially if you have liver inflammation or fatty liver. We need to have a look at that. And we do know that there is a high prevalence of thyroid issues in individuals who have non-alcoholic fatty liver disease. So if you've been told by your doctor, oh, you have fatty liver, you need to look at your thyroid. If you've been told you have high cholesterol, you need to look at your thyroid. General considerations for fatty liver, same idea. So if the insulin resistance there is, the high cholesterol is there, consider the things like berberine, annatto-E, and acetylcysteine is great for the liver. Liposomal glutathione is great for the liver. The best thing for you guys to do is try to find a practitioner that you can work with one-on-one so they can have a look at what would be the most impactful for you. It can become overwhelming on presentations like this where you're like, oh my gosh, do I have to take everything? No, but if you have fatty liver, high cholesterol, and insulin resistance, then perhaps the berberine could be helpful for you. Berberine is helpful for weight loss, decreasing weight around the midsection, reducing total cholesterol, reducing the bad cholesterol, LDL, triglycerides, and normalizing your liver enzymes. Yes, you can take berberine and metformin together. You just want to make sure that your blood sugar is not going too low. In addition, you don't want to take berberine with a probiotic at the same time. So berberine has some impacts on the gut health. It helps to remove overgrowth of harmful bacteria, and it does impact potentially the good bacteria too. So if you are investing your finances in a probiotic, don't take it with the berberine because it might mitigate some of the impact. So berberine, anywhere from 500 milligrams, 2 to 3 times a day is a typical dose. So if you're not seeing the benefits of metformin, you can consider adding that. Now, side effects of berberine can be the same as metformin in terms of you might see some changes with your digestive system, not typically to the same degree as metformin, but just keep that in mind. And the annatto-E is also one that's particularly great. So annatto-E is that very specific form of vitamin E, been shown to reduce cholesterol in just a month, which is really great, by lowering the total cholesterol by 15%, the bad cholesterol by 18%, and driving down markers of inflammation. Annatto-E is also fantastic for women who are postmenopausal, seeing hot flashes, as well as for women who have been told they have osteoporosis or osteopenia. So my goal is not to put patients on 20 supplements. I want to look at, okay, what is the one that makes the most sense for this individual and covers the most area? Okay. Thyroid panel. So a thyroid panel is particularly important. So we've seen a couple things. If you have higher cholesterol, if you have fatty liver, have a look at a thyroid panel. TSH is typically the only thing that's run. So let's look at this diagram. No, this is not a reproductive organ. This is the pituitary gland in the brain. So the pituitary sends out TSH to tell the thyroid to make thyroid hormone, thyroid stimulating hormone. Now, TSH tells the thyroid produce thyroid hormone. If the thyroid listens, it produces T4, inactive, converted to active. And remember, it's converted by the liver, the kidneys, the gut bacteria mostly. And then that T3 feeds back to the brain to say, okay, good, we don't need any more signal. When TSH goes up, this is a little bit backwards and confusing, but when TSH goes up, that is low thyroid function. That's the brain yelling at the thyroid, please, please, please make thyroid hormone. Running TSH is not enough. What if the brain is communicating fine, but the body's producing T4, but not a lot of T3? Well, T3 is the active. You're definitely going to have symptoms. So I see that a lot in my practice. The TSH is fine, but the body's just not producing enough T4 or T3. So you want to measure TSH, T4, T3, reverse T3, and the thyroid antibodies. thyroid antibodies tell us, is your immune system attacking your thyroid gland? Individuals who have thyroid antibodies, there's a higher probability that they're going to need thyroid support at one point in time. So monitoring an individual each and every year will allow us to intervene right away. In addition, we know patients who have thyroid antibodies can still have thyroid-related symptoms. And we want to not dismiss those symptoms. We want to help lower the antibodies if at all possible so that patient can feel better. One thing to keep in mind with thyroid testing, you need to always test your thyroid first thing in the morning. Up to 50% of low thyroid function was actually missed in this study when patients were tested in the afternoon between 2 and 4. So between 8 to 9 a.m., fasted first thing in the morning. Always really important. Now, my patients, I tell them just to go first thing, don't take your medication. If you are on a Synthroid or an Altroxin or a T4-based medication, you technically can take that medication the morning of because it has a really long half-life. But if you're on a desiccated thyroid or a T3 medication like Cytomel, you cannot take the medication in the morning. So just to be safe, I tell all patients, go in the morning, go fasted. Don't take any of your thyroid medications if you're on that. We also know biotin, a B vitamin, so it could be in your B complex, it could also be in your collagen powders, it could be in your protein powder, it could be in a B complex. You can't take biotin 2 days before you do your thyroid test. That can make it look normal when it's not. So here we are. This patient had a TSH of 4.09. You know, technically it's very close to within that normal range, but that is not normal. Why is the brain having to shout so loud for this individual's thyroid to listen, right? So we want to look at, do they have insulin resistance? Is there fatty liver there that's impairing the communication? What is their stress levels like? We know that the antibodies are low, so it's not the immune system that's attacking the thyroid gland, but it is important that we look at how we can treat this. Is there inflammation? Where's the vitamin D? And if we are addressing some of the other factors like low iron, low vitamin D, the inflammation, we have to repeat this test to see if it gets better. Fertility clinics don't like to see the TSH greater than 2 or 2.5, and I'm in the same realm. So if the individual has symptoms, we want to get that TSH less than 2, less than 2.5. The brain should not be screaming like that at the thyroid gland. Does that make sense with the TSH to the T3 and the T4, the thyroid gland, how the TSH, when it goes up, it's actually low thyroid because it's the brain screaming? I know that can be confusing when we're looking at thyroid panels. And again, the T4 is inactive. That has to be converted to T3. So we always want to see the T3 nice and high for individuals with resistant weight loss. Not too high, of course, that you have hyperthyroid, but just enough. So here's the ideal ranges. These are more the US ones. So if you're in the US, you want to screenshot that or check it out when you have the recording. These are more so the Canadian ranges. It does change, just the units of measure is different between Canada and the US. Again, it becomes whether or not you have symptoms, how are you feeling, how's your energy, how's your hair, how's your weight, whether or not we treat or not. One of the things that I often have a look at is also the ratio between T4 to T3. We want the inactive T4 converted to T3. If it's not being converted, you'll have symptoms, or you could have symptoms. If you're not converting, consider adding in selenium and zinc. So selenium you can get from 4 to 6 Brazil nuts, that's about 200 micrograms. And zinc you can get from about a tablespoon of pumpkin seed. So if you can incorporate those into your nutrition plan, fantastic. Or for some patients with a really hard time converting, we use this in a supplement form. Ashwagandha is also another amazing herb, been shown to normalize thyroid function. It's also fantastic for stress. A lot of times stress is the major impact on thyroid function. And I put ashwagandha in the cortisol reducing products. That would be a great one to consider. Ashwagandha also has been shown to bump up testosterone levels. So if you have lower levels of sex drive or lower levels of testosterone, that could be helpful. But if you have high levels of testosterone, ashwagandha might not be the best choice for you. The other question I got asked last time was, what about iodine? When do you consider iodine? what we'll see is a reduction in the T4 to T3 ratio. That's where I would consider iodine. Iodine's not right for everybody. It can make, especially autoimmune thyroid issues worse. So it's important to kind of look at the ratio before supplementing with that. Considerations for thyroid. We talked about the ashwagandha. That can be particularly helpful for individuals that just have that lower amount of T3. Inositol in the Relax and Focus is fantastic for lowering thyroid antibodies. So I have issues with Hashimoto's, issues with thyroid antibodies, and issues with cravings and blood sugar. So I actually made the Relax and Focus product for myself. It tastes fantastic. I'm biased, obviously, but it's almost like a fruit cherry, but not like a cherry cough syrup. It's really good. It has inositol, lowering the antibodies, keeping your blood sugar stable. It has magnesium to help with stress. It has L-theanine in it to promote more alpha brains in the brain waves so that when you take it, you feel calm so you can focus. So you can take it during the day, or you can take it before bed to reduce anxiety so you can actually get to sleep. Selenium and zinc are important for the conversion. We talked about that, the Brazil nuts and the pumpkin seeds. Some patients do particularly well in an autoimmune paleo diet for their thyroid condition. So this is eliminating a lot of grains, eliminating gluten, eliminating dairy. If that feels restrictive and you're like, whoa, I do not want to do that long term, you can consider doing an autoimmune paleo type nutrition plan for 4 to 6 weeks. Then every 3 days, add in one of the things you removed. So add in gluten and wait 3 days and see how your body responds. Gut health as well. Individuals who have acid reflux, indigestion, sometimes it can be seen as kind of like a tickle in your throat or a chronic cough. That could be symptoms of an H. pylori infection. H. pylori has been associated with increased risk of or increased association with autoimmune thyroid conditions. H. pylori we also see in higher levels in patients who are struggling with infertility. So the gut health does play a critical role. Yersinia is another type of bacteria that can trigger an autoimmune thyroid condition, and small intestinal bacterial overgrowth, which just means if you have the wrong type of bacteria in your gut, it can cause issues with your thyroid hormones. Because again, remember, where is a large proportion of the thyroid hormone converted? And the liver, kidneys, and the gut bacteria help with that too. So looking at gut health is particularly key for thyroid and also for autoimmune conditions in general. Next, let's move on to the cortisol. Cortisol is one of those hormones that gets a bad rap. Cortisol is our stress hormone. It's produced by the adrenal glands that sit on top of the kidneys in your back. Now, cortisol isn't all bad. It should be high within the first 30 to 60 minutes of waking. Cortisol being high in the morning gives you energy to pop out of bed. It helps to break down fat for fuel when you're fasted to give you some pep in your step in the morning. And having a rise in cortisol in the morning is really important for your immune system, especially modulating autoimmune diseases. So what is the best way to measure cortisol? It is by doing 4 measurements throughout the day, because a normal result in the morning is different than a normal result in the afternoon, different at nighttime. Hot flashes, waking up in the middle of the night, often issues with cortisol. So one of the nice tests or the nice parts about a urine test or a salivary test for cortisol is if you wake up in the middle of the night, you can easily do a sample and we can see, okay, what happened there when you woke up. So again, this is trickier to test with blood work, but this is the normal pattern that we should see. High levels of cortisol will cause waking around the midsection, and it'll cause increased risk of autoimmune conditions. We can see issues with breaking down lean muscle mass. So now you don't have as much muscle mass for your metabolism in your arms and legs. So much comes down to impacts of stress. This is the Dutch test. So if anybody's done the Dutch test or seen the Dutch test, this is a urine test that tests for all your hormones, but it also gives you 4 to 5 strips so that we can get a good idea about where the cortisol is throughout the day. That can be particularly helpful. It also tests for estrogen, progesterone, testosterone, and DHEA. And as we're going to see, hormones are all interconnected with one another. Impacts of stress, you can have chronic infections, you can get levels of stress from, of course, mental stress, work, relationships, Having issues with your blood sugar is a stress on the body. Having inflammation is a stress on the body. Gut infections is a stress on the body. Pain or injury, poor nutrition, all of that can cause issues with stress. And it's really important that we have a look at what is contributing for you. Stress is the #1 cause of weight gain that I see in my practice, as is insulin resistance. So those are the main ones that I see. They're not, it's never one cause, but so much of my patient population has issues with cortisol and issues with their blood sugar and insulin. Yes, you can order a Dutch test through a doctor. You'll get a better deal price-wise through a doctor, or you can order online. The Dutch test you can order by yourself as well. We'll chat about some of the websites where you can get that. 90% of all doctor's visits are driven by stress-related causes, or at least there is an underlying stress piece. Increases your blood sugar. It says, hey, there's a bear, you need to run away. We need sugared stats so you can run away. Well, if you have elevated blood sugar, of course, that raises insulin like we saw. Stress increases ghrelin, your hunger hormone, decreases leptin, your satiety hormone, decreases dopamine, serotonin, and norepinephrine. So now you're not motivated, you're not as happy. Stress lowers your thyroid function, impairs your immune system, can increase inflammation, leaky gut, and stress disrupts your sex hormones. Stress reduces progesterone because progesterone is progestation, right? It says sustain a pregnancy, get pregnant. If there is stress, your body sees it as a bear and it says, hey, it's not a good time to reproduce. So then we see a shutdown in your sex drive. You don't feel calm and zen before your menstrual cycle. Instead, you feel, women can feel irritable or even teary throughout the closer getting up to your cycle as well. Decreased melatonin and growth hormone with stress. So now you're not sleeping as deeply, which is a really good adaptive function to keeping us safe if we were living in the wild. If there's stress, you want to be a light sleeper in case there's a bear, but your body cannot differentiate financial stress and stress of a bear. Growth hormone also is decreased, so we see more rapid aging, lean muscle mass go down as well. We talked about this extensively. So this is just really trying to drill into you guys how important stress management is. You could literally just focus on sleep. Get your room dark, get your room cool, put on a guided meditation and fall asleep to it. It doesn't have to be anything long. Maybe it's 5 minutes and you fall asleep. Great, but at least you focused on your breathing. Are you taking breaks throughout the day? Are you hydrated? Are you consuming anti-inflammatory, nutrient-rich foods? Are you getting out in nature? Are you getting exposure to sunlight each day? Are you going outside and getting any fresh air? All of that's really important. Stress can be mental, emotional, but we talked about sleep deprivation can do it, dehydration can do it, early life adversities. So early childhood trauma increases your fight or flight response in your brain, exposure to blue light. So, we're chatting here late, but you're probably on your phone or your tablet or your computer. That blue light from your electronics disrupts your cortisol pattern. It impairs your body's ability to produce enough melatonin before bed. Consider blue light blocking glasses or at least dimming the screens on your electronics. Chronic dieting reduces or increases stress on your body. So in the reset program, that's why we jump back and forth between losing and maintenance, because I never want to put a patient in a low calorie diet or a deficit or any sort of restrictive feeding for too long, because that's a stress on the body. Even if your nutrition is not focused on calories, but you're losing weight, and 20 to 30 pounds in 6 weeks, that's a significant stress on the body. So we don't want to do that long term. Yo-yo dieting and even over-exercising can create more stress and inflammation. So how many individuals here have been told to exercise more and eat less? Exercise more and eat less. Put a yes in the comments. That's not going to be great for an individual who has levels of stress, right? So over-exercising and then you're not getting good sleep because you're trying to wake up at 5 a.m. and exercise and you're not seeing results. You're seeing that, your periods are heavier, you're more irritable around your menstrual cycle, you're seeing weight gain around the midsection. And, unfortunately in our society, we're just like, well, you're not doing it enough. You're not trying enough, which is definitely not the case. Here is something called the Krebs cycle. This is an important cycle that allows you to generate ATP or energy. So many individuals who have resistant weight loss are also low in energy. Now, in order to take your carbohydrates and take your fats and utilize them through the cycle to produce energy, we need all of these nutrients. If you're low in iron, if you're low in magnesium, if you're low in B vitamins, that's going to be a problem. Everything in green here, these are amino acids. So if you are not having enough protein in your diet, that's going to be a problem. The amino lean that I made is to replace this. So I understand, especially as a busy mom who is a practice and just lots of speaking and things like that, it's hard to be like, oh shoot, I need to make another steak. I need to make another chicken breast. So an amino acid powder can be particularly helpful for supplementing amino acids. It is definitely not a replacement, but it's just a powder that you can add to water. And sometimes I will admit I don't get enough protein at my meal, but as an insurance policy, I'm always adding the amino acids to that. Now, stress reduces the function of these cycles. Stress reduces the mitochondria levels and the productivity of the mitochondria where this happens. So we really have to manage stress, and we really have to measure and figure out why an individual is stressed and how to mitigate it. Now, lifestyle is key. So yes, I've made 2 supplements to help repair this curve. I've made Adrenal Ignite to cause the spike up in the morning. Essentially, the Adrenal Ignite provides the building blocks to build your cortisol in the morning. Then the cortisol reducer, or magnesium at night, is helpful for reducing the cortisol before bed. Now, if you are on your phone and you're on blue lights and you're staying up watching, binge watching shows on Netflix till 3 in the morning, please do not purchase a supplement for your adrenal health. You need to do the lifestyle aspects first. While the supplements can be quite beneficial, focus on lifestyle first. You have to go to sleep. I know that next episode is really, really impactful, but let's turn it down and go to bed. Now, how do you know where your cortisol curve is? Well, doing the test could be particularly helpful. What if your cortisol is high at night? Right? If it's high at night, fantastic. The cortisol reducer would be great. But maybe you're, high in the morning. Putting the Adrenal Ignite on there is not going to be particularly helpful for that individual. Testing can be helpful. I would say most of the individuals can do quite well on the cortisol reducer unless you have higher levels of testosterone. You might want to be cautious with the ashwagandha. Magnesium and the Relax and Focus can be helpful too. Relax and Focus I drink all day long, and you can do it with hot or cold, which I particularly like. We're almost getting to the end here, so hang in there. We're going to be talking about the sex hormones. So these are estrogen, progesterone, DHEA, testosterone. This is the regular menstrual cycle of an individual who is ovulating. So what we should see is the first half of the cycle, there's a higher amount of estrogen. And the second half of the cycle, there's a higher amount of progesterone. If you do not have this rise in progesterone, that tells us that you are not ovulating. Progesterone is the Zen hormone that keeps you nice and calm, maybe a little sleepy before your menstrual cycle, but you shouldn't feel irritable and you shouldn't feel really, really PMSy before your menstrual cycle. If so, it could be that this progesterone is not rising. If the progesterone doesn't rise and you're not ovulating, we do know there's a significant increased risk of certain types of cancers. So patients who are told, oh, it doesn't matter that you're missing your periods. Oh, it doesn't matter. It doesn't matter. Well, I mean, at the moment, it might not, but what about your risk of endometrial cancer and breast cancer and ovarian cancer? What about your risk of osteoporosis later on? All of those things factor into play. So I do want to see patients ovulating every cycle or most cycles and seeing that nice rise in progesterone. Okay. Now, when would you test? Well, if you wanted to test progesterone, you have to test 7 to 10 days before your cycle. Because if you test here, it'll just say it's low, right? It doesn't tell us anything to test progesterone here. I always have patients go 7 to 10 days. And I really want to look at what is the relationship between the progesterone and the estrogen before the menstrual cycle. Many patients have something called estrogen dominance, meaning their estrogen's too high. We get exposure to estrogen from our creams, so make sure to be looking at your skincare, making sure it doesn't contain chemicals that resemble estrogen. We know that individuals who have more adipose tissue or more fat tissue, that fat tissue is metabolically active and it'll produce higher levels of estrogen. So just based off of our society and our culture, we see higher levels of estrogen in relation to progesterone. This can cause PMS, make endometriosis worse, heavy painful cycles, headaches before your cycles, fibrocystic breasts, bloating, anxiety, all of the good stuff that we don't want to see before your period. So another great opportunity to test. You can test this with blood work or the Dutch test as well. Now we have to look at, okay, why would estrogen be high? If you have insulin or cortisol imbalances or weight gain, we can see issues with estrogen going up. If you're on an estrogen-based hormone replacement therapy or the pill that contains estrogen, of course, that's going to happen. Weight gain, poor diet, genetics, environmental, and poor liver health can raise estrogen too. Low progesterone is because you're not ovulating. So we would see irregular or absent menstrual cycles. We can see high amounts of anxiety, hot flashes, night sweats, vaginal dryness, headaches, migraines, issues with sustaining pregnancies. Always really important to have a look at progesterone. Progesterone begins to decline around age 30, really, really minorly, and then starts to pick up around 35. We often think of perimenopause or menopause as in, women in their 50s. Absolutely not. It can start 35, especially in individuals who are sensitive to the decline in hormones. Now, it's not just estrogen that declines. It's often the progesterone that declines. So we have more exposure and higher levels of estrogen. It's typically the progesterone that's causing a lot of issues for women. We do have really great options in terms of bioidentical hormone replacement and herbs to support progesterone. So if yours is low, then we can absolutely support that. And bioidentical hormones do not have the same risk profile as synthetic hormones. In addition, we definitely know if a woman is on estrogen, they always have to have oral progesterone with that. So keep that in mind. Anyone who's on estrogen replacement therapy, whether you have a uterus or not, you need to have the progesterone to balance it out as a protective mechanism for cancers. So what about menopause? Menopause, we see a decline in both estrogen and progesterone. You can see irregular cycles, mood changes, sleep disruptions, hot flashes, issues with your blood sugar. So women who are seeing hormone-based decline have more risk of insulin resistance and weight gain, less resiliency to stress. But those are things that we can test for and we can mitigate for. Things that you can do. Chasteberry or Vitex is a herb that's been shown to increase progesterone. St. John's wort has had some positive changes in women who are premenopausal and postmenopausal, menopausal on the mental aspect in terms of anxiety and depression. You cannot combine St. John's wort with a SSRI medication. Sage tea, 3 to 4 cups is great for hot flashes. There's berberine again. So if you can keep your blood sugar stable, that will prevent weight gain and it'll prevent hot flashes as well. Intermittent fasting for some can be quite helpful to manage the insulin resistance. Bioidentical hormones, fiber is really great. So if you are having hormone related symptoms or you feel like it might be your hormones, download MyFitnessPal. Track for a couple days. Are you getting 25 to 30 grams of fiber in your diet? If not, add some flax seeds or chia seeds or psyllium husk or the fiberline, the propylmanin. Really make sure you're getting enough fiber, and managing stress is particularly important. Here's an example of one of the pages of the Dutch test. So this is the urine test. It looks at your estrogen, how it's being broken down, right? There's some forms of estrogen. So if your estrogen goes down this green pathway, that's protective. We don't want it to go down the red pathway. This is genetically determined and increases your risk of estrogen-dependent cancers. And the 16-OH makes estrogen tissues grow. So we can see weight gain in the lower half, more stimulation for fibrocystic breasts and heavier menstrual cycles. So the Dutch test is particularly helpful. Now, this is a big, crazy, confusing diagram, but I absolutely love it because it shows the intricacies of how hormones are all related. So we want to know, where is your cortisol level here, right? So the cortisol level, if it's high, that could be why your progesterone's low. In addition, some women take their testosterone and convert it to DHT. That's the super testosterone. If that's the case, we can see higher levels of hair loss on the head, hair growth on the face, and acne. So this is perhaps one of the reasons why we're seeing women with adults acne. So we have a look at that. Then we have to look at the contributing factors, right? So what causes higher levels of cortisol? Insulin resistance, obesity, inflammation, hypothyroidism. So pairing the Dutch test for your sex hormones with some blood work can be helpful there too. The other thing I will mention for Every single individual on this talk, whether it's a hormone-related concern, a blood sugar concern, a cancer concern, Alzheimer's concern, anything, you need to consume cruciferous vegetables. Broccoli, kale, cauliflower, bok choy, Brussels sprouts. You are 22% less likely to die from all-cause mortality if you have 1 serving of cruciferous vegetables a day versus once a week. Now, if you're like, oh, those are all the vegetables that hurt my stomach, you might want to consider testing your gut microbiome to see if you have an imbalance of the gut microbacteria that's causing that. Vitamin D. It is not correct to say everybody's vitamin D deficient, so we don't need to measure. It's not correct to say, well, just supplement. So vitamin D is a fat-soluble vitamin, which means you can overdo it. I've seen patients in Florida who are getting tons of sunshine exposure that their vitamin D is still low. So it is important to test, not guess, treat appropriately, because if you take too much, it can be toxic. That concludes the testing for the blood work. I'm going to quickly pop over to the GI map, the stool testing that I run, and then we'll pop into a Q&A. So this is a GI map. It's a DNA-based stool test. It is one that is particularly valuable for individuals who have acid reflux, resistant weight loss, anxiety, issues with autoimmune conditions, constipation, diarrhea, Crohn's, colitis. So much begins in the gut. A lot of our immune system's in the gut. That's where the autoimmune component comes into. Why does the gut health have anything to do with mental health? A lot of your B12, a lot of your 5-HTP or your serotonin is produced by the gut microbiome. So this is a particular valuable test. Now, because a lot of you who find me are interested in getting to the root cause of weight loss and the root cause of low energy, I'm going to do a couple slides here about certain bacteria that relate to metabolic issues. Clostridia is really important. When you have low levels of Clostridia, you're more likely to have inflammation and autoimmune conditions. And when it's too high, you're more likely to have metabolic dysfunction, meaning insulin resistance, resistant weight loss. So Clostridia is one that I pay attention to, making sure it's in the optimal range for patients. Akkermansia, if you've never heard me talk about Akkermansia, it doesn't take you very long to scroll through my TikTok or my Instagram to see that I'm talking about this bacteria. When this bacteria is low, we see fatty liver, insulin resistance, weight gain, inflammation, type 2 diabetes. Akkermansia is very, very important. The GI map can test your levels. If it's low, what we want to do is we want to look at, okay, what are the ways that we can raise Akkermansia? Ways that you can raise it, treat the inflammation. Akkermansia does not do well under states of inflammation. It also does not do well on a high fat diet. So if you are doing an unhealthy ketogenic diet, you're not doing a service for your Akkermansia, and what you're going to see is you're going to see either no weight loss, or you're going to see issues with weight gain when you put carbohydrates back in. I think fats are great, fats are healthy, but overdoing, especially the saturated fats, is not a good idea for many individuals that I see in my practice. There is research on using metformin to increase Akkermansia. There is research on using berberine. There is research on omega-3s, so reducing inflammation with fish oil. In addition, the tummy tone probiotic, which you've probably heard me talk about a lot, contains Bifidobacterium animalis lactis B420. I just call it Bifido B420. That's been specifically shown to bump up Akkermansia. Intermittent fasting, caloric restriction, weight loss has also been shown to increase Akkermansia. Now, again, if caloric restriction is not working for you, the goal is not to reduce more calories. Calories are not the most important part. As we've seen from the previous slides, it's how your body is reacting to those calories and the hormones that your body's producing when you consume foods that's the most important. Tummy tone, in a double-blind randomized controlled trial of overweight individuals, Bifido B420 in combination with a prebiotic fiber has been shown to reduce weight loss. So there was a 4% reduction in weight loss with the B420 or the tummy tone on its own, and a 4.5% reduction when you're combining the fibrillin with the tummy tone. Many individuals can benefit from the fibrillin because it helps with appetite. It helps with being a prebiotic to support the tummy tone or the probiotic. In addition, it's fantastic for cholesterol levels and mitigating appetite, keeping your blood sugar really stable, suppressing the hunger signals. Now, you might be thinking, well, 4.5%, not as high as you would like, fair, but what we have to remember is a 5 to 10% loss in body weight has been shown to reduce your risk of developing diabetes by 58%. So reducing 5 to 10% is amazing. So in the reset program, that's what I'm aiming for. I'm aiming for about 10%. Most individuals in the 6 weeks will lose 20 to 40 pounds. And maybe you have more weight to lose, and that's amazing and that's fantastic. I'm hoping you're motivated to do that, but we're still gonna put you in the maintenance phase because I wanna teach you how to sustain your results and how to keep those results in a sustainable, flexible way that feels just like a lifestyle for you. And the maintenance phase is gonna be different for everybody. Here's another research study that they did on rats. They took the gut microbiome or the feces from the obese rat, transferred into the lean rat. The lean rat did not change its diet or exercise, but we saw weight gain, independent of diet or lifestyle, independent of movement, independent of calories that they consumed. What they found was something called the FB ratio, Firmicutes Bacteroides ratio. If this ratio is high, we see increased caloric extraction from foods, we see weight gain, especially around the midsection, impaired insulin sensitivity, and inflammation. Now, if you take a probiotic that is just over the counter and it has a lot of lactobacillus in it, that will further raise this ratio. You don't want to take a high amount of lactobacillus if you have a high FB ratio. The tummy tone will not raise the FB ratio. That's why it's bifido-based only. It'll help improve that ratio. And this is another aspect where berberine can come into play. So we know that berberine not only helps with insulin resistance, we saw that previously when we looked at the blood sugar, but it also has been shown to be antimicrobial. So it helps to reduce the overgrowth of the bacteria that is causing the imbalance and creating the concern for individuals. Here's what the, just another slide on the GI map test. So this GI map, in addition to looking at the normal bacteria, what are the quote unquote bad bacteria that might be overgrowing, the parasites, the worms, things like that, it also shows you how you're digesting your foods. So if you are not digesting your foods well, you might need a digestive enzyme. But if you are, of course, then you don't need a digestive enzyme. It looks for markers of colon cancer. It looks for how your immune system's doing. So for this individual, the immune system was suppressed. I see this a lot in individuals who have chronic stress, and perhaps this individual doesn't have enough nutrients to build their immune system like vitamin A and vitamin D. Also screens for Crohn's and colitis, and a marker for leaky gut called zonulin. It'll have a look at. So where to order? Blood tests can be ordered through a naturopathic doctor, a functional medicine doctor, a medical doctor. If you are in the US, you can go to yourlabwork.com. You can order your own blood work through Quest Labs. There are some states that are excluded through that, Arizona, New York, but a lot of the states you can order. Dutch test was the hormone-based test that we had to look at. I offer a discount to patients versus what's online. Medical doctor, functional medicine doctor, nurse practitioner, naturopathic doctor can order the Dutch test. If you're looking for your nutrient levels to see where your vitamins and minerals are, I prefer urine testing called organic acid testing. The blood test really doesn't tell you too much for nutrient levels, with the exception of iron, B12, and vitamin D. You can do those through blood work. And the GI map stool test is available to order online as well. Now, this is what my requisitions look like. So this is the male requisition. This is the female requisition for blood work. If you want to take a screenshot of this or have a look later on, this is what I typically would run standard on males and females. Now, depending on the individual and the signs and symptoms, I might add things on. This is where it's important to look at, what's going to be the most relevant for you. There's not one size fits all treatment approach, and there's not one size fits all testing approach, but more or less, this is what I'm running. All right, and ways to work together, and then we'll dive into the Q&A. I am the creator of the Metabolic Reset program. That program is designed to address inflammation, insulin resistance, primarily for individuals who have at least 20 pounds to lose. So typically we see 20 to 40 pounds lost in 6 weeks, but more importantly, we teach you about maintenance. So the weight loss part is, I don't want to say easy because I understand it's not, and there's a learning curve, and we help you with the mindset around food, but we really are focused on the maintenance piece. So how can we add foods back in? How can we teach you how to maintain? How can we get you out of the dieting mindset and be, looking at food as a tool to fuel your body? And how can we find foods that work for you versus foods that don't? I also have a private practice where I offer one-on-one appointments, and we can chat about testing that way. Couple testimonials here. So this is April. After gaining 25 pounds from the birth control, she knew that the hormones were related to her resistant weight loss, and she lost 25 pounds on the Metabolic Reset program. Alicia lost 26 pounds even with Hashimoto's, and the reason is we really looked at the immune system piece. How can we lower those thyroid antibodies? How can we support the liver health and the gut health of the thyroid works better? Courtney lost 45.8 pounds in 6 weeks. That is a lot of weight to lose. Of course, it's a big stress on the body. So in maintenance, we really need to scale back and help her to maintain her weight. Julio lost 32 pounds. His thyroid improved, cholesterol was down, and is no longer at risk of developing diabetes. Susie lost 50 pounds even as a busy mom while traveling. She has a great video. You can watch all the video testimonials on the website as well. This is another case study which I absolutely love, because here you see the TSH, the brain signal to the thyroid gland. This patient really did not want to take a thyroid medication. So I said, okay, let's do the reset program. Let's support the liver, the gut, reduce inflammation, increase your vitamin D, see what happens. There's still a little bit of a ways to go to get the TSH less than 2.5 where it's optimal, but definitely saw a bigger change, which is fantastic. The T3 was great at a 4.9. Hemoglobin A1C reduced by 0.2. So now they're no longer in the at-risk category of diabetes. Cholesterol, look at the major decrease in cholesterol from 4 to 1. That's great to see. The HDL, or good cholesterol, went up. So I was really, really happy with those results. This patient, we addressed the gut health. We removed the foods that were causing inflammation. What we saw is the iron improved. So the ferritin went from 13 to 54. So now the energy is better, hair growth will be better, triglycerides are improved. In this patient, the HDL, or the good cholesterol, actually went down. So I don't particularly like to see that. So this is a really great opportunity to say, okay, we really need to add in more healthy fats in the maintenance plan. I really need you to focus on either fish, fatty fish, salmon, nuts, seeds, olives, or adding in a fish oil would be great in this case. Insulin here. So this insulin fasting went from 77. So recall back, it's been an hour or so, but fasting insulin, I want to see it 20 to 40. They went from 77 to 21. So now this patient is in the optimal range. Great opportunity to say, hey, not only do I need you to consume more healthy fats, I also need you to cycle in carbohydrates, because your body now can respond in a favorable way to it. CRP, marker of inflammation, went from 2.5, so being in that moderate but normal risk category, down to less than 1. So significant reduction in terms of the risk of diabetes and cardiovascular disease. I think that is the end. Q&A. All right, so I'm going to go through these questions. If you guys have any more particular questions, I'm happy to answer them as well while we're on here. Let's start with the first one. So this question here, does hemoglobin A1C naturally go up with age? Yes, and that is often due to the decline in hormones. So when your hormones begin to decline, insulin sensitivity goes down. So your cells are not as sensitive to the insulin. Now, aging is not something that we can blame for issues with weight gain, issues with low energy. I do not believe that low energy and weight gain has to be a consequence of aging. So what you can consider doing is looking at, where's your vitamin D, where's your stress, where's your sleep, where's your hormones, what else can we do so that that hemoglobin A1C gets under control. So if you are at 5.8, you are in that at-risk category. Great opportunity to start reversing that. Insulin resistance is absolutely reversible, but it requires treatment. Oftentimes, just doing intermittent fasting and a lower carbohydrate approach is not enough. You have to treat the insulin resistance. We use options of pharmaceuticals in my practice. We use sometimes metformin or an injectable called Ozempic, or Victoza or Saxenda. Sometimes we'll utilize berberine. Obviously, we're doing diet and lifestyle. There is going to be benefits and risks and side effects of every single option. My goal is not to say, here's the option you have to do, right? I want to provide you with the benefits and risks of every single option so that you can make an informed choice. So everybody's risk tolerance is different. Everybody's going to respond differently, and you deserve to be equipped with the information to make the most possible informed choice. My hemoglobin A1C sits at a 5.6, so still in that at-risk category. I find it almost impossible to lose weight. So again, hemoglobin A1C just tells us what is your blood sugar over 3 months? What's the average blood sugar? So what I want to know is how much insulin does your body have to make to keep it under control? If you're in the at-risk category, I would highly suspect that the insulin is high. You're becoming insulin resistant, because over time, if insulin resistance is not addressed and is not treated, then your blood sugar starts to creep up and creep up and creep up. So anybody who's in that at-risk category, I mean, you want to test to be sure, but I would assume anybody who has a hemoglobin A1C greater than 5.5 has insulin resistance. Can inositol work as well as berberine? For some individuals, it all depends. So one of the side effects of inositol for some is diarrhea. So if you're experiencing that and inositol is not working for you, or you're getting acid reflux with it, then perhaps do a different option. So if we can do a treatment option, monitor for 8 weeks and see how you do, how are you feeling, then we'll know if it's working or not. Inositol has added benefits for ovulation. So if a woman's looking to get pregnant, then I would look at the inositol. You can use metformin if you're looking to get pregnant, but berberine does not have safety studies on it. So there's nothing to prove that it's unsafe, but there's also not anything to prove to be safe, and we don't really risk that with fertility. I would try, if possible, to avoid eating 4 hours before bed because it can interrupt your deep sleep. You guys can't see me, can you? There we go. So I recommend avoiding eating 4 hours before bed. Now, if you eat before bed and you feel really good and that's your routine, then everybody is different. So if it's working for you, great. You can take metformin and berberine together. Berberine, I have 2 brands that I utilize for berberine. I use the Designs for Health Berbavale, and I use the berberine that I've made. That's my brand. So my brand's got the BK symbol. Both of those you can get on my website or Amazon. But okay, let's be cautious with Amazon because you want to make sure that you can buy Designs for Health on Amazon. Just make sure it's a reputable company. I hope that clarified it. Not all supplements brands are created equally. Amanda's asking, I received my GI map stool test results 2 days ago. Was awesome for ruling things out and confirming that I have leaky gut and issues with high anti-gliadin IgA. Amazing. So high anti-gliadin IgA shows that you're sensitive to gluten. Some individuals can be sensitive to gluten and have celiac, but you can be sensitive without celiac disease as well. And oftentimes when your gliadin's high, zonulin's high. So a marker of leaky gut. Some things that I love for leaky gut are, of course, a gluten-free diet in your case, but looking at marshmallow and zinc carnosine. The Gut Revive that I made is my go-to for leaky gut. Can I take berberine while I wait to have an appointment with you? It may or may not be helpful. It may or may not be safe. So I have to be cautious providing individual recommendations on here. Berberine is pretty much safe. Send me a message. Can berberine cause heart palpitations? I've not seen that, but if your blood sugar is going too low because you're taking too much of it, that can cause your heart to race more. Berberine causing insomnia could be your blood sugar is going too low. So that could be, have a look at, do you have enough protein throughout the day? If your cortisol is low, you want to know, is it low when? It's a total low throughout the day, or are you just low in the morning? Ways to increase cortisol is to provide your body with the building blocks. So looking at B5, B6, vitamin C, licorice, ginger, or not ginger, sorry, Panax ginseng. That's a product for low cortisol. I've made the Adrenal Ignite, kind of giving you the building blocks. Now, sometimes the supplement is great for individuals. Sometimes it's not strong enough and you need a prescription called Cortef. I've been to a hormone clinic and I have all those blood work results you've shown here. I have your GI map ready to take. If I were to sign up for the Metabolic Reset program, Would I have to retake any of these or just review the results? If they're recent, I definitely can review the results, of course. And the other thing with regards to, do you need testing to start the metabolic reset program? No. So the way I've created the metabolic reset program is to address what I typically see as the root causes, addressing the cortisol, addressing the mindset around food, addressing sleep, addressing stress, addressing insulin resistance, cortisol, making sure you have all the nutrients in terms of diet. Everything is in there. So I'm assuming most individuals are coming with some level of insulin resistance, and I'm assuming everyone's coming with cortisol issues. Now, if you have a thyroid issue that's undiagnosed, the metabolic reset program is not giving patients, like we're not giving people thyroid medications. So that would be one caveat that I would say. Ideally get that. Now, some patients, what I'll do is they'll start the reset program, they'll lose the 20 to 40 pounds, and then we'll measure the blood work after. Because I know a lot of the problems that come up on blood work will be resolved with that weight loss anyways. You can rewatch the meeting. Yeah, so the recording for this presentation, along with a discount code, will be emailed out 24 hours after. And the discount code is for anybody who wants to consider purchasing the supplements. The other thing to keep in mind, I've tried really hard to put together good tech sheets for the products. So you do not have to buy my products, but if you're interested in learning more about the ingredients, go to my website, click on some products, and download the tech sheet. So the tech sheet, what I've done is I've tried to summarize all the research with regards to why I feel that product is helpful. There was a question about whether or not the ashwagandha Goldie gummies are good. So the thing with ashwagandha is there is a big diversity in terms of the standardization process. So you want to look for sensorial. I can write that, sensorial. Sensorial is sensorial. I'm sure I'm not saying it right. It is the standardized ashwagandha to contain at least 10% of the active ingredient that is needed. So if you've tried ashwagandha, even in the appropriate dose, but it wasn't the high percentage of the active component, then you might not get the benefits of it. So I would have a look at, is the Golgi gummy sensorial and is it in the right dose? If you want to know the dose of ashwagandha, look on the tech sheet for the cortisol reducing product. If your ferritin is low, you definitely don't need to address that. What we would want to look at is, if you know it's low, we would recommend that perhaps we add on an iron-based supplement. If you talk to one of the coaches, they can get in contact to me and we can address that. Now, ferritin being low, we always want to know why. Are you not consuming enough in your diet? Are you not absorbing it because you have an issue with your gut health? Or your period's really heavy? So the one case that I showed you guys, for a participant in the reset program, their ferritin went from, I think it was like 13 to 53 or something. It increased. And the reason it increased is because their gut health was better. They no longer had acid reflux and their hormones were better. So their periods weren't as heavy. So yes, taking iron can help, but we want to know, fix the underlying issues so you don't have to be on iron forever. You shouldn't be on iron forever. Okay, I hope that was helpful for you guys. What I'll do is I'll put this together. You'll get the recording tomorrow. Feel free to share that recording with friends and family. So just share the email if you found that helpful. It'll be linked over to that. And if you guys have any additional questions, follow along on TikTok or Instagram. I'm happy to answer questions for you. So I hope that was helpful. Have a great evening, guys. Thanks for tuning in.